Hi, this is Sunil Rao in beautiful San Diego at the SCAI 2018 Annual Scientific Sessions. I'm here with Prashant Kaul from Piedmont in Atlanta, and we're here to talk to you a little bit today about Transradial chip programs as well as the SCAI Transition for Value program. So Prashant, you're a dedicated radial operator, and I think some of the issues that you've dealt with have to do with operators who may feel uncomfortable using radial access for complex patients. Tell me your perspectives on that and how do you allay some of those fears?
Thanks, Sunil. I think that's a valid concern. I mean, I think, after over 24 randomized controlled trials and over 20,000 patients, we've established that there's superiority of the radial approach. That's not an issue anymore. The question really is, how do we now get folks to adopt the approach? And I think you've got to just jump in. You've got to really start and do all cases. I think initially some people may pick and choose certain cases, and they're never going to get there. You've got to go radial for the regular, straightforward cases so that you're ready to tackle the more complex and more difficult cases radially as and when you need to. So really you make a decision in your lab, you get all the equipment and the protocols around you in place, and then you go for it and then work up. It's good. There's a learning curve. From work that you've done, we know it's anywhere from 100, 150 cases, but you've got to start somewhere and just jump in.
What programs does SCAI have to help people who are maybe interested in transitioning their lab to a radial first strategy?
So recently SCAI has partnered with others to come up with the Transitions for Value approach, which basically in one place will put together the best practice guidelines for radial procedures and help those that are interested in transitioning to this to put into place a radial program and use those best practice documents to help them along the way.
Yeah, you mentioned the SCAI Transradial Best Practices document, which has been really I guess a clearinghouse for all the evidence that supports best practices for improving outcomes and minimizing harms. Tell us a little bit about what some of those best practices are.
So those best practices start all the way from the right type of equipment and approach for assessing if a patient's ready for a radial approach, getting access, the equipment, anticoagulation, and then even procedures and protocols as they relate to same-day discharge. So, for example, we should all be using hydrophilic sheets. The Allen's test is not something that is relevant anymore. And so we should actually not be using that and be denying patients the benefits of the radial approach if the Allen's test happens to be abnormal. And so similarly along with that, anticoagulation during the case and so on. There are a number of issues to understand at each section, at each point of the procedure, and these are all outlined in the best practices document.
Now, there's been a lot of evidence being generated in the radial space since the release of that document. Is there a plan to update that soon?
Yes, so actually the updating is well underway and almost complete and should be released within the next few weeks.
Great. Well, thanks for joining me here, and again, thanks for watching. Again, we're here at the SCAI 2018 Annual Scientific Sessions.